Good morning and happy Sabbath. Thank you for continuing to watch with us here at Tabernacle Seventh-day Adventist Church. We're glad that you are worshiping with us today. My name is Baldwin English Jr., an elder here at Tabernacle, and we're going to go right into our health nugget. As you know, we've been trying to present pertinent, relevant facts in relation to the COVID-19 crisis that we're all facing. And I have a special guest with me today. His name is Kester, Nedd. I don't want to miss anything, so I'm going to ask you to introduce yourself and tell us a little bit about yourself and what it is that you do.
Thank you, and good morning to Tabernacle family. Well, most of you know me. I'm a physician. I practice at the University of Miami. I have a private practice in neuroscience in Doral. My specialty is neurology. I also specialize in neurological trauma and neurological rehabilitation. That's me.
All right. I think beyond that, he's a businessman and has many businesses and so forth, and we'll get to that another time. So, you know, Dr. Nedd, you said you're a neurologist, and as we've been putting these programs, these health nuggets together, we focused on nutrition and mental health. We've got a behind-the-scenes look with Dr. Ashley about how hospitals are dealing with this. But in my wildest dreams, I would have never thought to ask you to participate from a neurologist perspective, because I was not aware of any connection between COVID-19 and our neurological functions of our body. So can you share with us a little bit about that connection and why, I guess how you got involved in this from your professional perspective, and why that is, why how neurological functions are being impacted by this disease?
Well, simply put, back in China, they noted that several young persons who did not have risk factors for stroke, after being infected by the virus, were experiencing stroke-like symptoms, and some of them went on to develop strokes. The recent study published in Italy and between the Dutch and the Italians from autopsy studies shows that well over 50% of the people who died from COVID had strokes. And of course, multiple organs. And we are seeing the same here in the United States, to where young people are dying from stroke. So of course, when you look at a disease, you have to understand why. And if you understand why, then you're able to find treatment methods. And so this, even though we're in the early stages of this condition, you're trying to understand the nature of the disease, the natural history in terms of how it progresses, it's imperative that we find answers to these questions, because people who develop strokes and other organ failures, generally this marks the terminal stage of the disease. So once you get to that stage, you're in bad shape. Yeah.
Gotcha. So this is affecting people that previously have some type of health conditions that make them predisposed to having strokes, or I know you mentioned younger people. Why are younger people getting it, and is there any type of predisposition that would make us be aware of someone that may be impacted by this?
Well, certainly people with risk factors who have cardiovascular disease, who have previous strokes, high blood pressure, obesity, diabetes, any of these what we call non-communicable diseases are more likely to succumb to the effects of the virus, partly because of the mechanisms in which the virus works. And maybe I could explain that a little bit.
Sure.
So there are different stages that the body goes through once you get infected with the COVID virus. Of course, it's caused by a virus called SARS-2. It's an RNA virus. It has that virus, once it invades the body, generally through the mouth and nose, or any kind of mucous membranes, it travels into the body and literally infects blood vessels, the wall of blood vessels. There's a set of cells called the endothelial cells. It also infects some other cells in the body that goes in the bloodstream responsible for fighting infections. But those cells act like a barrier between the tissues and the bloodstream. Once those cells are violated, substances are not supposed to leak from the blood into the tissues, and substances from the tissues leak into the blood. Whenever that happens, that's foreign to either side, and the body starts reacting towards it and creating inflammation. So you go from infection to, with the virus, the body infects it, the virus spreads to these cells, they're called endothelial cells. And then once those endothelial cells are affected, they're the junction cells. So there's leakage of substances going on. Then you get something called an inflammatory reaction, where the body's immune system starts taking over, and it overreacts. It starts secreting these compounds, we call them acute phase reactants, and while they're there for positive purpose, because they're excreted in excessive amounts, they actually cause harm to the body because the body becomes inflamed, similar to something like arthritis or lupus or those other conditions. Once that happens, now we got trouble. So the damaged blood vessels, or the damaged walls of the blood vessels, starts accumulating debris. It starts trapping cholesterol, platelets, which are the clotting mechanisms, and also factors produced by the liver that's responsible for clotting. Now you have what's called a thrombus or clot. So think of it, you have a little depression in the wall of the blood vessel, and all that stuff from the bloodstream accumulates and starts clotting. Once you start having a clot or a thrombus, it becomes a magnet to sort of pull all the other clotting factors that your blood needs to stay thin. So it dries those factors up, and the clot becomes large and starts occluding the vessels. Here's what happens. As the heart beats, the blood pressure breaks up pieces of that thrombus and propagates it to the rest of the body, because now the bloodstream is like a canal system.
Right.
So now you have those little clots going all over your body, going to your heart, your lungs, your brain, your intestine, your skin, and now that's called a thromboembolic stage. So that's when you start getting strokes.
Gotcha.
That's when the lungs become occluded.
Okay.
And people develop something called ARDS, adult respiratory distress syndrome. And what happens is the surface that the lungs has to exchange gases between the lungs and the bloodstream, that becomes compromised. And that's why people have trouble breathing. So it's a problem with the body receiving the oxygen that you breathe in. The body has inability to absorb this.
Gotcha.
Now, here's what's happened finally.
Sure.
Once you consume all the clotting factors in your blood, you start bleeding because the blood can't clot. And that's what happens prior to people dying, because now the organ fails and your entire vascular system collapses because you can't clot any blood because you used up all the factors. So that's the mechanisms by which this disease affects humans.
That's very interesting. We talked earlier this week after you made a post on social media. This kind of brought this to my attention. And you mentioned to me during that conversation that we're going to see a lot of discussion on this, about this in the media, and truth, as it would be, yes. Even through yesterday, I saw information on CNN, they were talking about this. There was a Washington Post article that mentioned a doctor conducting some surgery, removing a blood clot, and right before his eyes, he was seeing other blood clots forming. Yeah. So it sounds to me like the medical community is becoming aware of it, and they're hopefully that word is spreading amongst the medical community, and they're looking out for these factors. But what if I'm at home and I'm sitting there with someone that's 45 years old and they're otherwise healthy? What factors should I be looking at that may suggest that this person is having a stroke or something like that?
Well, that's a very important question in today's world, because we have such modern treatments available for stroke that if you catch it early enough, guess what? You could reverse it.
Gotcha.
So generally speaking, what we look for, someone presenting with loss of body function, weakness, numbness in an arm, a leg, if they have double vision, dizziness and vertigo, particularly if they have spinning sensation. All of those signs and symptoms of blindness in one eye, or not seeing half of your visual field. Sometimes bad headaches and profuse vomiting out of control. These are all symptoms that suggest neurological insults. And the quicker you get to a hospital, and particularly you want to go to a hospital that have what's called a primary stroke center. Those hospitals are equipped to be able to literally give you a drug to potentially dissolve the clot, or they do this interventional procedure where they could put these catheters into the brain and literally take that clot out and recanalate or open up the vessel again. And we could see, I mean, it's amazing. If you go to the angio suite, you see patients who have this condition, their stroke is reversed right in front of your eyes. It's just amazing. So these treatments are available today. And it's important, not just for COVID standpoint, but for others who are at risk for getting a stroke.
Good, thank you, thank you. You know, we are encouraged to socially distance ourselves from each other still. I know Florida is opening up. Miami-Dade County is still not open as of yet. You have to wear masks when you go into certain establishments and so forth. Is there any other tip that you would give to us to be able to avoid even contracting the disease?
Yes. Well, first, in disease conditions, we like to think of two aspects of managing a disease. One is called primary prevention, and the other one is called secondary prevention. Primary prevention has to do how you prevent yourself from getting a disease. Very critically important. So the measures that we institute covering your face, in close to 90% of the time, if you cover your face and your nose, you will not spread this disease or catch it. To be honest with you, if the world covers their face for 2 to 3 weeks, we will eliminate this virus because it would not spread. That's a common sense thing to do, but we're not going to do it. That's the cheapest way to solve the problem with the COVID virus. Next, of course, if you don't cover your face and the virus escapes in the atmosphere, others are likely to get it. It gets on your clothes, it gets on inanimate objects, so you could pick this up. These are called fomite spread. So once you get that, then the idea is to clean your hands, clean your face. The virus is susceptible to just about every cleaning agent out there, including the hand sanitizers. So if you use those on a regular basis, you prevent the virus from spreading, and you have enough time to do this. And these are called the barriers in terms of those. So that's the first step. If in fact you get the disease and you get the condition, then the next thing is how do you prevent the virus from getting to the cells in your body, okay? And that's where medical therapy comes in. Remdesivir is the first line drug that we now found out that it has some activity against this. It's an antiviral agent. There are other antiviral drugs. Sometimes some people use Tamiflu. There are other drugs. Azithromycin has been shown to have some benefit. Chloroquine, although it can't work at different stages, but certainly the part that prevents the virus from getting into the cell is mainly what your body does, and that's producing antibodies. But there's a time lag between when the virus comes into your body and your body is able to produce an antibody to fight the virus. And that time lag allows the virus to reproduce quickly and cause damage. What actually hurts you is not the virus itself, is what the virus does to the cell and how the cells in your body reacts. That's what really causes you to die.
Gotcha.
So, so we then aim therapy at the other stages I described. So now you have the, after the infectious stage, you have the stage where the cells are invaded. Okay, so we want to now protect the body from overly, you want inflammation to take place, because that takes out the debris from the body, that helps to remove the virus, kills the virus, but you want to prevent your body from overreacting. So we use drugs that commonly used in treating arthritis and immune disorders, in treating cancer. These drugs actually drop your immune system and causes it not to overreact.
Right.
And there's a drug, tocilizumab, which is shown to have benefits. It's a drug used in arthritis. There's a factor that we call cytokines in the blood. There's an excessive release of cytokines, and they damage healthy tissue, and they also damage tissues that are not so healthy. These drugs help to inhibit this activity from taking place.
Okay.
It's been shown to have some value. Once you do that, the last phase is the clotting side,
Sure.
which we talked about.
Right.
So what you want to do is to prevent the clot from forming. So the same drugs we use in stroke to prevent clots would be drugs like anticoagulation drugs. Lovenox is one of the drugs that's been used. And now a lot of the hospitals are starting to use that as a protocol for people that come in who are infected with this so they don't get to that stage. Because once you get to the stage where you start clotting, then you got problems.
Okay. Okay.
The last phase
Sure.
would be if the clotting occurs and you use up all your clotting factors, given things like plasma to have to restore the clotting factors. Sometimes the plasma also from persons who've had the disease also has antibodies that'll help you to fight this. So clotting, the plasma that you get from somebody else's blood also helps to fight the condition.
Well, excuse me. I'm glad to see that there are some treatments and protocols that are being proven to have some success against the disease. I need to close out now, but I want to thank you for coming and spending this time with us and opening our eyes to understanding a broader picture of the impact of COVID-19. Before we close, and we've gone over a little bit, I would like to give you an opportunity, because I know you've written a book that is about to come out, and I know you at least have a Facebook page at Dr. Kester Nedd. Right? Someone can Google that on Facebook and at least come across that page. But what is the name of that book? When will it be out? And where can people find out more about it?
The book is on the brain. It's about concussion and traumatic brain injury, but it tells stories about the patients I've seen over the last 30 years of my career and how they have been impacted by injury to the brain. In fact, injury to the brain occurs in over 50 million people per year. It's an epidemic proportions, even more than the virus.
Right.
But yet we don't pay as much attention to this, but it affects our kids, how they learn in school. It affects adults, how they relate with their family. In the prison system, for example, between 65 and 92% of all persons in the prison population have suffered a concussion or traumatic brain injury. So it impacts our society in sports, people coming from the military, and so the book is about this, and it's called also The Silent Epidemic.
The Silent Epidemic.
Yes.
Okay.
So I've introduced a method of evaluating and treating patients with traumatic brain injury called the BETH method, Brain Hierarchical Evaluation and Treatment Method. And it looks at the brain as a hierarchical structure and how the brain is injured and how it recovers. It's an interesting book. It's a lot of stories in it.
So a layperson would enjoy that book with some of the stories that you have to tell.
Absolutely.
Okay,
It's written
good.
so that a layperson could read it.
Awesome. Well, Dr. Nedd, thank you so much for spending this time with us. We thank you again for joining us, and stay tuned as we begin our divine worship in a few moments.